do is, of course, pull up. Let me go back. On your competency day, we will have 3 different competencies in there. Don't you dare look at your competencies prior to you coming in here. You can only pull up the competency once you enter in here and you get started, or else you're cheating. That's like looking at the test questions before the test. All right? So whatever you do, don't look at the competency one.
But how will you know?
How will I know? Because I'll see it on my end as an instructor that so and so looked at it at this time. They have it in minutes, seconds, and all of that. And who did it?
Everything.
Yes.
Everything.
So we'll see that of who looked at it prior to their competency. And if that happens, guess what? There it goes. There goes your first try.
Automatic 0.
All right, yep, you get a 0. Then you're going to have to do it again for your second try, and you can only make a max of 80 on that. All right? So whatever you do, do not cheat and look at the competency ones. The practice ones in there are for you to practice with. Okay, there's 2 of those. Okay, we've opened those up so that you can practice on those at any time. Competencies will only be open of the day of. So if you're waiting out there and you go, oh, let me look at that competency, you might as well go home. All right? So you just forfeited and you cheated.
We always use the university policy for cheating.
Yep.
It's not working.
So that's not very good at all. Okay? All right. So once you come in here, remember, once I start, go ahead and get to the point, and they're going to tell you which competency to pull up. There's going to be either A, B, or C. They're going to tell you which one they want you to pull up. Okay? Then you pull that one up, and then you start looking at it, making sure you're looking at the patient's name, their allergies, are they allergic to anything? All right? I'm going to then pull up my orders, and then I'm going to look to see which drugs I'm going to be given. And you can then at that point do that split screen. Okay, if you want to do the split screen, then I would do it. That way you can look at both of them. Now this practice one has tons of different practice ones. I'm only going to pick a few. Okay, so what you can do is do the split screen, and that way then you can tell which one is what. So once you look at the orders, okay, now I know, let's say I'm going to do morphine and potassium and the insulins. So when I know that, then I'm going to go to my assessment, look at the pain scale, and see what my pain is, to see if he's eligible for whatever meds, whatever pain med is accordingly to what's ordered. Because some of the orders will have one for mild pain, one for moderate, one for severe. All right? So you got to figure out, well, which one is he according to the pain scale that I see on here, so I'll know which one to give. All right? So I looked at the pain under assessment, and then I'll look at my vital signs, right? If I have any sort of vital signs that I need to know, such as you just got through talking about pain, what do I need to assess with pain as a vital sign?
Blood pressure,
Yeah, blood pressure, and what else?
heart rate.
Well, besides that, what is the big thing? She just got through telling, yes, the respirations. What is all those OD people that OD on all those opiates and everything? They're passed out. We're not doing CPR, remember? We're doing breaths on them, right? Well, sometimes we'll do CPR, but still. Yeah, so remember, it depresses the respiration. So I'm going to be able to look at all of that on here, all right? If you want to jot down what it is, you can. So, all right, so what else am I looking at? I've got Demerol. I've got insulin, so I need to look at my glucose, don't I? So I'm going to go with diagnostics, and I'm going to pull up my basic metabolic, and so I'm going to look at glucose. All right, and it's 160. Okay, is that high? 160? Is that high?
Mm-hmm.
Yes. All right, so yes, so knowing that, so I may jot that down too. All right, so so you need to toggle back and forth looking at whatever information you need to find out about your patient is going to be on there. Okay? Y'all got that?
The more you practice, the more familiar you will be, and it'll be much easier for you
Yeah.
to find what you need if you've been in that practice one and done it like repeatedly. That creates like muscle memory. Like you'll know exactly where to find everything if you. The more you practice, the more.
So then I
efficient
know,
you'll be.
let's see, let me look at the, so I'm at the MAR now, all right? So I know he can get all the meds that I'm fixing to pull for him. So let's say, okay, here's potassium. So I want to go ahead, if you wanted to, now that you're at the station, make sure you do your hand hygiene, all right? You can at this point go ahead and say your 6 rights. I have to go ahead and say it. Usually I'm gonna have all the 6 right signage down. That's what I can remember, all right? So then, okay, let's see. What am I getting? Potassium. So you need to be able to find it quickly, all right? Here's my first check. Potassium. 20 milliequivalents, expires 2025, and it's PO. Yep, that's what I wanted. First check is that. Then my second check is, does that compare to what I'm looking at? Yep, potassium 20 milliequivalents every day. Yep, that's what I want. So there's my 2 checks. Where do I do my third?
Bedside.
All right. Okay, so my next thing is I want to give insulin. All right. So, what, see here, this is why you do your first check, is because look, NPH is in the regular. All right. So the regular's over there. Okay, so regular. My first check, regular U100s, expires 2025. Regular insulin. What's my glucose? It was what?
160.
All right, so that tells me I got to give 3 units. Okay, so that's regular insulin. That's for that.
Is that a scale?
Yes, I have a sliding scale. on
Okay.
there, yes. So in NPH, I have my first check. Is this NPH? U100 expires 2025. NPH, I am going to give them 4 units of this. All right. So, okay, there's my first check. Now, so for insulin, what do I got to do first? Roll it.
Hey,
Yeah.
remember on your insulin guide, okay, not all insulin is sliding scale. So some patients may get a long-acting insulin, like in the morning or in the morning and at night, and that may be all they get, okay? What usually happens is they may be getting long-acting, or they may not be getting any long-acting. They may just be getting short-acting. Because what happens with diabetics that are in the hospital, or they're stressed, or they have surgery, it makes their sugar go up. So they may not have had to use insulin. They may have been an oral hypoglycemia, or taken an oral like metformin, and then they come into the hospital and they may need insulin temporarily, or they may take insulin at home and need it. So usually, if it's on a scale, we're going to check their sugar before meals and at bedtime, and give them a dose based on the value that we get. So if it's 0 to 150, we give nothing. If it's 151 to 200, we give this, or this however many units. But they may not get both. Does that make sense? They may not. They may just get one or the other. They may just get short acting, or they may just get long acting, or they may get both. So don't let that trip you up, and always looking for a scale, because there's not always a scale. Just
Yeah,
follow
so-
your order.
So in other words, NPH can just say 10 units, all right, before breakfast, all right, and then your regular has a sliding scale, okay, depending on your glucose, all right. So sometimes, yeah, if your glucose is like if it's 70 or 80, in other words, I'm not going to give the regular, but I will give the NPH, all right. Okay, so after I've rolled this, then I've got to remember wipe all these vials off. Okay, I grab my insulin syringe. NPH, I wanted how many?
4.
Let's just say 5. I'm just gonna do. Okay, I put my air in. Remember, I let go of that. See how this is moving a little bit? I'm gonna get rid of that air. All right, it's moving a little bit.
So she put air in the cloudy.
Yep. And now I'm letting it do its thing.
Now she's gonna put air in
Yep.
the clear.
And then let's say if it was 5. Put that. And then I'm gonna pull
The whole purpose for this is so you only give the patient one injection instead of.
Now with regular insulin, now remember, since I only have one syringe, one vial of meds, I can pull whatever and see how it creates that little vortex. Sometimes it gets away all the little bubbles. If not, you can just click on it. Once I get to the amount, if I still think there's too many bubbles, then I can pull more out and I can just play with it, all right? Now once I do that, what do I need to show to somebody? You're going to show the instructor of what you have. You're not going to tell them, but you just need to show them. That's your second verification, okay? Then I can go into my NPH, and then I will pull up. All right, and then show the instructor again, okay? And then make sure, now, they can either put the medication back in, when you're mixing, remember to put your mixed solution back into the cloudy, the NPH. Don't put it back in the regular, you won't mess it up, all right? So your instructor will either tell you to push it in there and just pull whatever the amount of units, all right, of air, because you're gonna inject air into everything, all right? So they're either gonna tell you to do that, or they'll just get you to waste at the bedside. We'll just get you to push it out into the waste basket, that'll be there, okay? So now I got to recap, all right? And then remember, I've got to label this syringe, don't I? What am I gonna put on this?
What it is.
Yeah, each one, regular, whatever units, NPH, whatever units, the patient name, date of birth, all right? You can write the physician's name, and usually I put my initials.
And what time you gave it.
Yeah, well, I'm fixing to give it, so.
So if you like, you feel
Yeah.
like you know how much money you pulled it out, you can do that. But most of you want to put the patient's name or what's in the syringe.
Yeah.
Because if you're walking down the hall and the Joint Commission department, they stop you and go, what's in that syringe? And if it's not labeled,
And remember, if you put the patient's name, you better put the date of birth. There's gotta be two identifiers, because sometimes there's the same patient's name on that floor, all right? So once I have all that information on here, I usually put it toward the bottom of it. That way I can fold it on so I can still read it, all right? So that's on there. So remember, you're gonna have to bring your vials to the bedside, all right? Now let's say, what was my other thing? It was pain meds, wasn't it? Demerol. So here's Demerol. All right. Was it what?
Morphine.
Thank you, morphine.
She's about to get raw medication.
I know, right? So thank you. Okay. First check, morphine. Morphine, 10 milligrams per mil, expires 2025. Then I'll look at my MAR and make sure how much 10 milligrams. So if this is 10 milligrams per mil, what syringe am I going to use? A 1 mil syringe? That means my plunger is going to be all the way out here, isn't it?
3.
Yeah, I usually use a little bit bigger than what the amount I'm going to pull. Now, since this is 10 milligrams per mil, what if the doctor ordered 5 milligrams? How many milliliters would I get out? Half. Yep. All right, good. Okay, so.
maybe a little calculation that you have to do.
Yep. So remember, I know how much, remember, and the first thing I did was looking to see how much he weighed and all that stuff. So I could use a 1 inch. He only weighs 140 pounds, 72 inches. So I could use a 1 inch. If they tend to get a little bit larger, I can use the 1.5. All right. But just make sure you can find your syringe quickly. It would behoove you to use a syringe that has the needle attached. All right. Because there are some needles here. There's some needles here. There's some syringes here. They're by themselves. So that just takes longer. All right. So it would behoove you to use one of these. Okay? All right, so always grab you a handful of these wipes. Wipe that vial. Okay. So I wanted one, didn't I?
Now have your drug cards handy, because your instructor may ask you, why is this patient getting this drug? Or, you know, what are we looking out for when we're giving this medication or something like, may ask you some questions about your drug.
Yeah. So here's, I'm gonna get one. Now, if I have trouble with the bubble, I'll stick my needle back up in there, and I'll usually try to gently move that bubble up there, pull this back down, and then of course pull my bubble back up there, and then pull out. All right. For this case, I'm gonna stick it all back in there. All right. Here's my end of my needle, my cap, and take it very carefully on the recapping, and on here, and then what I want to do,
Label it.
yeah, make another label. All right, so I've got a label on there, stuff on there. All right, so I've got my 3 meds up here. I got my PO, my sub-Q, my IM. So I want to make sure that I bring all the stuff that I need for the injection. So I'll have my alcohol wipes, and I'll need a gauze, and I need some Band-Aids. All right.
Gloves are gonna be at the bedside.
Yep.
So your gloves and your chopsticks all at the bedside.
All right. So we'll bring all this over here. I'm bringing these with me. All right. So I'm all over here at the bedside. Knock, knock, knock.
Okay.
Hello, I'm doing hand hygiene. Hi, I'm Debbie. I'm the student nurse today. Can you tell me your name and date of birth and what are you allergic to? I see the name. If they're allergic to something, I want to make sure there's an allergy bracelet. Okay? All right. I am here today to give you your medications that your doctor ordered. All right? Okay, did you say you weren't allergic to anything? I'm allergic to aspirin. Okay, good. Well, I don't have aspirin here, so good. All right, so here's my third check. While I know I've got the right patient, here's my third check to make sure I got the right patient. Now, do I have all the right meds? Here's my potassium, 20 milliequivalents. Here's my regular. I've got 5 units, and then I've got 5 units of NPH. Then I've got 10 milligrams of morphine. All right, so there's my third check. You need to be able to verbalize I'm doing my third check. All right? Now, you can then tell your patient, okay, I'm here to give you the following medications. Potassium, remember that's for, you're taking Lasix at home, so I'm giving you some potassium to offset you going to the bathroom all the time. All right? I'm giving you your insulin, that's for your diabetes. Okay, because a lot of times you can look at your diagnosis too. And your Demerol is for your pain. What was your pain scale again? On 0, nothing, and 10 is your worst pain you ever felt. So they'll say 8. All right? Okay, so you're verifying all that. Now, are you allergic to any of those? No? Okay, good. All right. So, what you need to do is go ahead and get him ready. I would go ahead and say I'm going to do the curtain since I'm going to expose him somewhat. Go ahead and get your bed comfortable to what you want to. If you wanted to, go ahead and lift his head up so he can swallow his pills. Okay, I'm fixing to give you your medicine to swallow. Do you have any trouble taking your pills? That's a lightning. Yeah. Oh, yeah, I'm gonna scan. Yeah, I was gonna scan them in a minute since I used to go. Yeah. Do you have any trouble swallowing? Can you take your pills at once? Yes. Okay, there you go. There you go. Please don't not let these pills go down the patient's mouth, all right? All right, just, we're gonna put them all back, okay? All right, okay. Now, you can go ahead and put in your gloves now, or you could put them on as soon as you enter the room. I don't care, as long as you have your gloves on before you give your injection. Now I do want to go ahead and check all of this with my should that
should they go ahead and plug that in like as soon as they get into the room? I would probably do that just so you don't forget. Just as soon as you get into the room with your iPad, go ahead and plug it in.
Yeah, and when you go into the room, go ahead and what am I doing? Potassium. Okay, so my potassium, I'm going to scan the patient barcode, and you should see the patient's name. Yeah, I should have done this before you gave the PO.
Remember that you scan the patient before.
Right.
It won't let the program.
Scan that.
MedTech won't let you do anything until you scan the
Yep.
patient.
Scan that patient's name and it should come up. And then, of course, you'll then see potassium on there too. Okay?
Let me say something real quick. If you're at, I was at one hospital where you scanned all the medicine, then you scan the patient.
Yeah.
Whereas you should, others are scan the patient, then you scan the medicine.
This one is going to make you scan the patient barcode every time. All right? So go ahead and keep this flipped open so you can scan that barcode every time before you give those meds.
Is there a
All right.
particular screen that we're going in to scan the patient?
Yes. Yes.
Okay.
You're going to, once you hit that, let me go to like regular. Here's MPH. Once you go into the drug, it'll tell you on here, the first thing you got to do is hit scan the patient barcode. All right? Actually, this, you know what? It already does that. Because now I can scan. Was this the regular? Okay, good. Oh, it was NPH. Now, if you scan the wrong thing, it's going to say medication barcode does not match. Remember me telling you that? So it was the NPH. There I got the NPH. So I did just find out. So when you have multiples, that you don't have to scan the patient barcode every time. It's already kind of muted out. So you don't have to do that the second or third or fourth time.
So
All right?
You just scan the
You just
patient
have-
band the first time,
Yep,
and
yep.
then you can scan all your medications.
Yep.
That's how Willis 90
Yep.
theirs works.
And just make sure you hit scan the medication barcode before you scan the medication. All right? But you should not have to scan the patient barcode once you've done it once. All right? Okay. So let's say I've scanned all of my drugs. So that's what you can do is go ahead, go back, make sure you scanned everything. I'm giving also.
You said it'll mark it green when you've done everything.
Yes.
Is that what you said?
Yes.
Okay.
It'll morphine. So I've already scanned that. So scan the. Yep. And it'll say morphine. All right. So I've scanned all my meds. All right. Okay. So now I know I've at least scanned all of my meds. Now you can administer. All right. So I'm going backwards. Here you go. All that. Can you take all this? Take that. Now, of course. Now I can give him his sub-Q.
So I don't know. This one lets them scan all the drugs and then chart all their stuff after the fact. Because, like Willis Knighton, for example, you scan the armband, you scan the meds. Like say it's insulin, then you can go in when it pops up the insulin and chart your site after you can give it and then chart your site before you scan the next med.
You can if you want to in this. You
Okay.
can do that.
Or they can
Or you
scan all the
can do
meds
each.
and then
Yes,
go in and
yes,
okay.
yes. Or and then go in later and do all that, and then you can hit administer.
Because there's like if you let's say you scanned it and the patient says, oh no, I don't want that, then it has a drop down box for you to chart
Right,
patient
right.
refused, and then you go on to the next med.
And this does too. It has at the very bottom. It says not given reason.
Okay, so
And you
do it
can
either
go
way.
that.
Okay,
Yes, you
gotcha.
can do that too. All right, but you can scan all your meds like I did at once, or you can do each of them.
You just gotta remember to do your
You have to do it
documentation on all
right.
your stuff.
It's just that, yeah, you have to do all that other stuff because then once I input everything after I've administered, then I can hit the administered blue button. All
Does
right?
that prevent them from? And then after that,
Yes.
you can't go back
Yep.
in there.
Yep. Yep.
Okay.
So that's why I just go ahead and scan everything.
Make sure you got
All
all
right.
your stuff done. before
Yep.
you hit
Because I can
the-
always go back to input all the information I want to, such as site and everything else. Okay? So, where was your last injection site for your insulin?
On the
And
right
the-
side.
Yep. All right, I'll go on your left. Make sure you have on your gloves. Please make sure you have on your gloves. That's an automatic
We keep
fail.
saying that for a reason.
Yeah, it's an automatic fail. All right, once I clean it really well, I usually leave that about an inch away.
Make sure you check the
It really sucks that we did everything.
Make sure you perform hand hygiene.
He doesn't weigh very much, so what degree am I going to give this insulin? Yeah. So I can go at 90. All right. So remember, all right, here we go. Go in, give the med. Remember, that was just air. All right. And then come out. Go. What happens with this?
Sharps.
Yep. So I got to walk all the way around here, put it in sharps.
Immediately. Do not mess
All
with
right.
it. Do not pay $200.
Yep. Yep. Do not recap up here.
Directly you two sharps.
Teddy, how many people
All right.
go to recap and I'll just look at them and they'll go, oh, I wasn't supposed to do that.
All right. So now I'm going to give you your, and you can if you want to, put everything on a little tray. I will have the things right here for you in case you wanted that. All right.
And now
So,
you can see how to do.
yep. All right. So what I'm going to do, I'm going to use my middle finger, and then I'm going to put my middle finger on the top of that iliac crest, right? I'm going to slide it along to that anterior suprailiac spine. Thumb is pointed on the pubic area, and I can feel the greater trochanter with my palm, right? So I'm going to go right there at the bottom of my V, all right?
These three fingers to the iliac crest, which is like the rounded curved part, okay? That's to the back.
Then I wipe it with the alcohol, go out, put it about an inch away from where I'm going to go, let it dry.
Put your alcohol right above where you just wiped so that you don't lose your spot. Because once you clean it, you can't go back and touch that spot again, or you got to clean it again, right?
All right, so now I need to do what? What's that called? Z-track. Yeah, I'm going to move that muscle out of the way so we can seal it when I get through. All right. So I'm going to give you the bevel's up. I can see the inside. Okay, 1, 2, 3, and I go in all the way to the hub. All right. And then I give my medicine according to whatever meds it is. All right. So you give you that, and you can wait. How long do they tell you to wait?
I think your book says a meal, 10 seconds per meal.
Okay. Yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. And come out as fast as you can. Let go of that Z track, and then this goes directly into sharps. Oh, there it is. All right. But this will go into sharps. All right. And then of course you can. This is what your little thing is for in case they got some bleeding, and then of course you can put your Band-Aid on. All right. So that's for that. Now that I've given his drug, now I need to do some education on what I gave him. Okay, so I just gave you your insulin. You need to eat your breakfast tray when it gets here. All right. I gave you some pain medicine. Do not get out of bed unless you call me, because I don't want you to fall. Your pain medicine may make you drowsy. All right, so I don't want you to fall. If you gave them some antibiotic, I usually would tell them, please let me know if you have any signs and symptoms of an allergic reaction, such as if you feel like you're feeling itchy all over, you're getting a rash, you feel funny around your head and neck, you need to let me know. All right. If I give them some heart meds, usually I will tell them too that you could see a drop in your blood pressure if you get out of bed quickly. All right. So these are just some simple things you're trying to explain to your patient of what they need to do or don't do. All right. So it's just simple things according to what you're giving. That's why you need to know your drugs and of course what effects they have, so you'll know what to explain to your patients. All right. Let's see what other meds. You know, if you're giving them aspirin, that's for anti-clotting. Make sure you're careful whatever you're doing, because you will bruise easily. All right. You know, it's just those kind of things, just simple explanation. So once you're through with all of that, Let me make you comfortable. You've got to make sure you put the bed at the lowest position. What other things you got to do? Tall
Side
light
rails.
within reach, 2 side rails up times 2. And you got to do everything. You can't just say it, you have to do it. All right? Okay, do you have any questions? No, all right. Now, if I gave them pain meds, I am going to reassess. I need to say I'm going to reassess you in the next 15, 20 minutes, okay, to see how your pain is then. All right, so anytime you give pain medicine, you need to make sure you know you have to reassess, and the instructor wants to hear that. All right? Okay, I think that's it. Get rid of your gloves. So once you leave the room, and do your hand hygiene. All right? Or whichever. Yep, it's right
Now,
there.
once they're done, they just unplug from the,
Yep.
unplug their iPad, and then they can finish their documentation
Yep.
and whatnot. Okay.
Yes, and leave all your adapters up here, all right? Whatever
One
you're
or-
using, leave everything
One
up
of
there.
each plus the scanner. 'Cause
Yep.
which one, how does the 2 different things work? Which one is which?
Well, I have, this is the, all right, this is like the lightning adapter. Got these little white little bars on it, it's real tiny. Then you've got the C, you know, the ending is the C one. All right, so look at your computer to figure out which one you're gonna use. Do not waste valuable time trying to figure out which adapter I need. All right, they'll both be up here, along with the scanner.
The more
Okay?
you practice the process, the better off you'll do on your.
And
Yeah, you pinch an inch.
And these, there is some medication instructions for y'all that will be at the your tabletop wherever you're documenting. It kind of gives you some instructions, but you should already be familiar with this. There's also instructions just like this by each medication station for FYI, all right? But you should be very familiar with this already, but this is there just in case you need some prompts. This is for documenting afterwards. Now remember, your documentation afterward is not part of your 30 minutes? 30 minutes they have? Okay. So it's not inclusive of your 30 minutes during your competency.
But you do need to do your documentation immediately after, like before
Yeah.
you leave the room.
Is putting your vials up part of your time?
No.
No, once you finish, we're gonna stop your time.
Yep,
Every-
yep.
All that putting it up and
Yep.
charting is not included.
But that's a good question. Please make sure you put up all these, all right? Because only these that are in there are barcoded. Now, FYI, you need to go ahead and take a picture of that medication station so you're very familiar with where your medications are and quickly be able to find them. There are a couple of meds in there that we try to trick you up with as far as route. Okay, so you need to be aware of all those 6 rights. You know, we don't say 6 rights for nothing. They mean something. Every one of them means something. All right, so you got to make sure, and that's what we have up there is we're trying to trick you on the route. So just be aware of that. All right. When you come in here to practice, please make sure you bring your medication kits. Everything that's in there is what you'll need to practice with. Do not take the insulin and the IM syringes and needles from my stock that's back there. That is for y'all to use during your competency. All right? You just need to be able to find it quickly. Be able to find your insulin syringe. Be able to find your IM injection syringe quickly. But don't use them during your practice in here. All right? When you're practicing, do not use that blunt needle on these vials. All right? On any vials up there. You use those blunt needles, guess what? It makes such a huge hole. We can't use this vial again. It starts leaking like crazy. Now, because I have students in here that y'all are constantly poking in and out, in and out, in and out, sometimes they do start leaking on its own, all right? And we'll get rid of those. But still, don't make it worse by using those blunt needles, all right? So do not use blunt needles at all while you're practicing. And of course, there's no blunt needles back there for you to even use during your competency, all right? Let's see. Remember, take a picture of the bins. And remember too, on all your syringes and etc., remember to pull back air. So air is to be given in all the mannequins. All right? So sometimes your instructor will get you to go ahead and dispose of the actual medication into the trash bin and then just pull up the air and you'll inject the air. Okay? Or they'll get you to put it back into the vial up there. It's up to them. All right? So just remember that. Only air gets injected into the mannequins. And remember, your gloves are right there. Gotta make sure you use those gloves. If you want to, pull those gloves ahead of time. That way you'll have them right here. And don't forget to put them on. Now you won't get in trouble, of course, if you don't use them for PO. But I'm just always afraid you're gonna forget. So put on the gloves ahead of time. You can have gloves on and give PO. That's fine too. All right? Remember too, if you have to cut a pill, you better bring a pill cutter from up there. There's not going to be any in the room. All right? So you've got to identify, oh, I've got to cut a pill, and you got to make sure you bring it with you to the bedside. You're not actually cutting it, all right? But you got to identify that with your instructor. All right? Don't actually take it. You're not going to take any of your medicines out of the POs. All right? Don't take them out. Ever. Okay? We reuse these. But you do have to identify it if you do need to cut a pill. All right? Just make sure you bring that pill cutter with you, and you're just going to say, I'm going to cut the pill in half. All
So
right?
what if I forgot something and I leave and I go back to the medication station? What happens?
Yeah, what if I say, oops, dang gummit, I forgot some alcohol swabs.
And I walk back there and I have left that medicine unattended. What happens?
You fail.
It's a big
Never leave your medicines unattended.
So what I gotta do is
Always
take
take 'em with
all
you.
this
Take 'em
back with me, and then guess what? Now I gotta start all over again. I gotta start all over again. Hey, I'm
So you want
Debbie.
to leave
I'm
your
your nurse
medicine
that forgot to get the dang gum alcohol. What's your name, date of birth, all that stuff. Start scanning away, and then yeah, you gotta start all over again. Yeah.
Is it what a big fat zero is?
That's what those little stars are
That's
for.
what the double asterisk are.
All right, let's go over this real quick. All right, so this is what we're going to be evaluating.